Hello, my name is Christine Brown-Wilson. I'm the Program Director for the University of Manchester, BSc Honours Nursing Practice, and we look forward to welcoming you to our course. I'm going to be talking a little bit about our course and what you can expect to learn when you come to study with us. The School of Nursing, Midwifery and Social Work is ranked amongst the top schools of nursing in the UK and Europe. You will be taught on this program by international experts in their field. So by this you will actually have very much an evidence-based curriculum for which you can prepare your future nursing practice. We offer you a University of Manchester experience here in Singapore. Our course philosophy has been developed in order to meet the needs of nursing and nursing practice in Singapore. Our course has been developed in partnership with the Ministry of Health to ensure that you, as the future leaders of nursing, will be equipped to meet the healthcare challenges that are emerging within a Singapore healthcare context. Within our curriculum, we work through the evidence base for practice. It is very much around how you critically analyse the evidence and then how you might effect change within your area of practice. There are opportunities within both the first and second years where you can analyse that evidence and then look at ways of applying that. You will undertake a dissertation where you can actually write a program of change that you can take back to your hospital or community environment. So our course is quite different to a number of other post-registration courses you may have encountered. We offer a 2-year full-time pathway that will take you through some of the things that you may have looked at in your pre-registration education, but we will go into more depth with these topics. And then we will move on to new and exciting areas of practice where you can make a real difference as healthcare changes here in Singapore. One of these areas is supportive and palliative care, where you will undertake a clinical placement and you will look at the complex symptom management required for people who may be dying. And as we know, most people in Singapore will die in hospital. So the information that you develop here on the palliative and supportive care unit will enable you to consider how you might improve practice in this very important area to improve the quality of death for people here in Singapore. We also know that globally the population is ageing, and that is no different in Singapore. A lot of older people tend to have complex healthcare conditions, and one of our units will support you in the assessment of complex health conditions, but it will also help you to effect more effective discharges and then maybe prevent future admissions for people when they don't need to come into hospital. And this is an area I know is important both in the wider world as well as here in Singapore. And finally, we have the Manchester Leadership Program. This program is unique to a degree in the University of Manchester. In addition, you actually receive a further certificate, and you can study this certificate at either gold level, where you will be doing 60 hours of volunteering and community work. You could achieve this at silver level, where you are doing 40 hours of similar work, or you could achieve it at bronze level, where you would be doing 20 hours. And by undertaking the Manchester Leadership Program, you will be equipped with leadership skills. You will be taught in this program in Singapore before you go into the Overseas Immersion Program by international experts in the field of global health, sustainability, and leadership. And you'll be developing the skills that will equip you when you return to your nursing practice at the end of this program in order to make real changes in the Singapore healthcare context. We look forward to welcoming you at the University of Manchester, and we trust that you will have a very fruitful and enjoyable time with us, and you will come out equipped to make a real difference to healthcare here in Singapore.